Hello dear learners, welcome to the next module of the course on Geography of Health and Well-being. Today you will learn about the definitions, scope and approaches of medical and health geography, the historical evolution of geography of health and well-being, and its nature and scope. In this module, we will discuss why to study geography of health. Why? Geography is important for public health policy. What is medical geography? What is health geography? What is the evolution of health geography? And what are the approaches and scope to the study of geography of health and well-being? So let's move ahead with the statement given by Dr. Trevor Dummer in 2008. He stated, "Geography and health are intrinsically linked. Where we are born, live, study and work directly influences our health experiences. The air we breathe, the food we eat, the viruses we are exposed to, and the health services we can access. The social, built, and natural environments affect our health and well-being in ways that are directly relevant to health policy. Spatial locations, the geographic context of places, and the connectedness between the places plays a major role in shaping environmental risks as well as many other health effects. Geography is important for public health policy. 1. To make informed decisions for development of effective public health policy based on evidence. Second, for understanding disease risk factors and how risks such as genetics, lifestyle, environment, and occupation interact with the social, built, and natural environment is important for policy making. Third, geography helps in understanding the arrangement of health services. Its location and nature of environmental exposure is crucial in assessing the interrelations inherent in many health-related risk exposures. Many core geographic research themes, including health inequalities and polarization, scale, globalization, and urbanization, are directly related to public health. Now let us discuss health and medical geography. Are they same? Are they different? Although medical and health geography are used interchangeably, they are not the same. Medical geography is an older subdiscipline under human geography, and health geography is of recent origin. They are different in scope, methods, and approaches, and we'll see that. How? There are many viewpoints on origin or evolution of health geography that we'll discuss here. But before we discuss the evolution, let's understand the definition, scope, methodology, and themes under both medical and health geography. Medical geography. Before 1960s, disease mapping and disease ecology dominated the subject. The quantitative techniques were successfully applied to the concepts of disease. Medical geography traces the interrelationship and interdependence between the environment and human health using concepts and techniques of geography. For a medical geographer, the focus is on location, place, and space on which human activities occur. The recent themes of medical geography. The research focused on geographic distribution or spatial patterns of medical care, healthcare facilities, provisions and use, disease, and access to utilization of healthcare services. Attention was given to spatial distribution and trends of health indicators. In the early 1990s, research was conducted with the help of geographical information system. The methodology was quantitative and it was dominated by the use of statistical and mathematical frameworks. Geography of health and well-being, which deals with the interaction between people and the environment. It is closely aligned with epidemiology. Its distinct primary emphasis is on spatial relations and patterns. Whereas epidemiology is predicated on the biomedical model and focuses on the biology of disease, health geography seeks to explore the social, cultural, and political frameworks for health within the framework of social organization. The themes and approaches of health geography. A health geographer may follow humanistic approach and may be interested to understand what people believe or think about healthcare. People are humans and not to look them as numbers. As per the structuralism or critical approach, one tries to understand the role of broader social structure in affecting health. Instead of measuring inequalities, developing a critical view of health disparities along with their causes and consequences becomes the foundation of this discipline. The cultural pluralism is that to understand the meanings of health and healthcare in different cultural contexts. The distinct themes of health geography are emergence of place as a framework for understanding health. There are two-way relationship between health and place. Place can be as locations, so small as a home, rural area, urban area, or local area, or landscape. They could be hotspots of disease or therapeutic landscapes. Theory building on the basis of social and cultural theories and a quest to develop critical geographies of health. The methodology used in health geography is largely qualitative in nature. The research areas of health geography range from services, infrastructure and land use planning, therapeutic and healthy landscapes, disease surveillance, modeling and mapping, disease etiology and determinants of health, placements of structural infrastructure such as hospitals and clinics, often using GIS technology, traditional medicinal plants and healing methods, accessibility and equity of health services, inequalities in health outcomes, how health and disease can be socially constructed. There are various viewpoints on the origin of health geography. It is very much clear by now that both medical and health geography use different methodology and concepts, although both deal with human health in relation to environment. Hence, both are different kinds of geographies. The paradigm shift model by Kuhn states that paradigm change takes place through revolution. But in case of health geography, rather than a revolution, evolution of medical geography in 20th century led to the growth of health geography. This is one perspective, one viewpoint. The biomedical approach that was used in the medical geography was replaced by ecological approach or holistic approach to overcome the limitations of older traditional methods of medical geography to modern health geography. Health geography is inclusive, comprehensive and holistic, just like health. Health geography is reformed medical geography and a post-medical geography of health that is more holistic, socially relevant and placing it in a context of justice. This post-medical geographies of health incorporated cultural and humanistic approaches. It has integrated place, identity and health into medical geography and placed it with social geography, thus making it dynamic and contemporary. Similarly, Litva and Iles noted that medical geography is old-fashioned and should address new issues to tackle concerns. And to tackle these new concerns, we have a new term. A group of scholars believed that medical geography is essentially bifurcated into two parts: geography of disease and geography of healthcare. The former describes disease frequency, illness occurrence, relationship between illness and associated environmental factors, answering the three major questions of geography, that is, who, why, and where. The latter, on the other hand, describes the facility location, accessibility, utilization, and patient behavior patterns. Bentham in 1991 noted that the dichotomy between these two streams of medical geography, that is, between geography of disease and the geography of healthcare, became blurred and became more open to influences from the outside world. This led to intertwining or combination of these two streams, that is, re-articulated medical geography as health geography. While Cassino and Doan argue that it is just renaming to include new approaches and increase the scope of medical geography, as this may be helpful rather than embodying dualism. Some of the important definitions of medical geography are: by Divise, medical geographers try to find out some answers like who gets what, where and why, with respect to illness and appropriate care. Woods state that medical geography is defined as a systematic study of spatial dimensions of health, disease, and healthcare, while the World Health Organization stated in 1986 that medical geography is to include the applications of geographic methods and perspectives to aspects of health and healthcare. Some of the significant definitions of health geography are by Ward 2004. It is the application of geographical information, perspectives, and methods to study health, disease, and healthcare delivery. Kearns and Mons state it is a study of distribution of health-related phenomena and the processes that shape them over time and space. WHO in 1914 stated that health geography is science and art of applying geographic information, perspectives, and methods to the study of health of population, communities, and individuals. Approaches to geography of health and well-being. Geography of health and well-being can be studied through following approaches: biomedical approach, ecological approach, spatial approach, social approach, and systems approach. Biomedical approach. It is the application of positivism in health geography. The cause and effect relationship between causative agents and symptoms was extensively researched to improve health. This is related to the biomedical concept of health. It requires collection and analysis of statistical data and predict the health outcomes and understand the disease prevalence. The biomedical perspective of health that considered health in a very narrow sense, ignoring the social and mental aspects. Ecological approaches. The ecological approach believes that people are a part of interdependent ecological systems. It builds upon the understanding that there are causal relationships between environmental conditions and health outcomes. This approach recognizes the dynamic nature between people and their environment. Now, the point to keep in mind is that the environment does not only mean the physical environment, it is also social environment, emotional environment. Geogens are non-living agents of disease, and people are exposed to these geogens through air, water, food, and other sources. In the 19th century, initiating improved medical and public health practices like vaccination, chlorinization, sewage treatment, availability of clean drinking water has reduced the infectious diseases. This approach is criticized, and many scholars now believe that free will, medicine, and behavioral changes and adaptation are important in changing the relationship between health and environment. Human health is considered as a part of integrated disease cycle, rejecting the idea that humans and environment are separate identities. Also, adaptation is dependent on evolution and can be hereditary. Spatial approach. This approach explicitly investigates the importance of spatial attributes such as location and connectivity. The health data, spatial and social distributions, and inequalities can be visualized and communicated through maps. Disease mapping allows identification of hotspots or therapeutic landscapes, understand the spread of infectious diseases, resource allocation, and help in policy making. This can help in identifying gaps in healthcare accessibility and availability, thereby aiding policy interventions. This approach can also be utilized for mapping health behaviors and lifestyles, for example, tracking sleep behavior, physical activity, or dietary habits that can now be tracked by modern instruments like smartwatches and other gadgets. Social approach. This approach considers the ways in which human health and well-being are influenced by society, rather than biological factors. Systems approach. Recently, ICSU has proposed systems approach to study health and well-being of a region. A system can be defined as a complex of living and non-living parts interacting in networks, establishing networks of interacting components, and behaving as a coherently organized entity. System approach goes beyond the fact that health and well-being is affected by multiple factors. It includes feedbacks, interdependencies, and interactions between individuals and environment over time. The system of health and well-being can have two types of problems, that is complicated and complex. While the former requires linear causality and can be solved through hierarchical situations using quantitative analysis, the latter has circular problems that are multidimensional and require qualitative information. Next, we come to the interdisciplinary nature of geography of health and well-being. Interdisciplinary field that examines spatial dimensions of health, well-being, and healthcare provisions. The purview of health and healthcare research overlaps with many science, social science, and management disciplines. For example, epidemiology, to do cohort studies, clinical trials, epidemiology of communicable and non-communicable diseases, with chemistry, to understand the reactions in air, water, soil that can cause diseases, with psychology, to understand mental health and counseling, with environmental science, to understand how climate change and extreme weathers like disasters have impact on health, media and information technology, for health education, for promotion of health, for awareness generation, training, and experience sharing. It also is interconnected with management, like managing the delivery of healthcare services and medicines, especially in rural areas, in far-flung areas where it is difficult to connect. History, to understand the evolution of diseases, changes in the pattern of spread of diseases, the treatment modes and evolution of medical system. Political science, to understand the evolution of policies and programs for improving health at local, regional, national, international levels, and now also at global levels. To understand or to delve into the health of refugees, the role of public-private partnership and community in generating healthcare services, legislations and acts. With economics, cost of health services, cost of ill health on economy, role of insurance sector and healthcare, to conduct a cost-benefit analysis of any health service, economic behavior, to find out the optimal locations of services, to understand the demands of health services in the overall marketplace. Sociology. Health differs from gender, race, age, caste, religion, special needs, and other social indicators on health. This is studied in collaboration with sociology. It also tries to delve into availability and accessibility of healthcare services, equality, habits, and lifestyle of these various groups. Demography, for calculation of birth and death rates, prediction of future population, infant mortality rate, life expectancies, total fertility rates, age-sex composition, family planning, and population policies, and also migration and health. Very important, movement of people and its impact on health. Urban planning and regional planning has its interface with health to demarcate areas for health planning, for transport management, for management of sewage, housing, living conditions, and other environmental factors that influence human health. Law. Laws for improved health and environment, distribution of healthcare services and infrastructure, polygamy laws, social laws, occupational related laws, especially related to mining or hazardous occupations, is very crucial for understanding the healthcare system. Statistics, sampling and analysis, and interpretation of data tests of significance. Disaster management, healthcare in emergency situation, preparation of a first aid kit, safe location of hospitals. To identify these safe locations, we need to collaborate with people who are working in the area of disaster management with health specialists. Cultural anthropology that tries to understand the problems of disease related to diet and nutrition. And the list goes on and on and on. Scope of geography of health and well-being. The scope of geography of health and well-being, as you can see, is very vast and diverse and also complex. Disease mapping, mapping the origin, transmission, and clusters of diseases. Identifying high-risk areas underlying movement of people or migration with the spread of diseases such as COVID-19 or HIV/AIDS is the scope of geography of health. Environmental health. Geographers examine the impact of environmental factors on health, such as identifying the role of disasters on human health, the effect of air pollution, water pollution, noise pollution, soil pollution. Now, in the present times, light pollution, impact of mobiles on human health, sewage disposal, extreme heat or cold on people, and various other environmental factors that we are exposed to. Healthcare accessibility and use. Geography of health investigates how geographic features influence the access and use of healthcare facilities. The distribution of services is also determined by geography. For instance, the rugged mountainous areas have low health infrastructure as compared to accessible plain areas. Health disparities and social determinants of health. Geographers explore how social and economic factors such as income, education, race, ethnicity influence health outcome. They can map food deserts and food oases and correlate it with socio-economic status of people to understand health disparities in terms of nutrition. Medical tourism and global health. It also investigates the globalization of healthcare, including movement of patients across nations for treatments, role of global agencies influencing health. Geographers can also identify potential destinations for medical tourism, such as Ayurvedic tourism in Kerala or in Himachal Pradesh. Urban planning and health. Health geographers collaborate with urban planners to create healthier cities. They can plan urban areas keeping in mind the access to green areas, water bodies, healthcare facilities, transportation, food environment, and emergency route, thereby help in creating healthy, inclusive and sustainable cities. Thank you, dear learners.